Jonah, patient assessment trauma. It's the last one.
Yeah.
You have 10 minutes to complete. Do you have any questions before we begin?
I do not.
Okay. You are dispatched to the city pool. Somebody dove in the shallow end and is now unresponsive.
Okay. Besides scene safe.
Yes.
Is this my only patient?
Yes.
Okay, my MOI is they dove into the shallow end of the pool, unresponsive. Always going to call in additional resources if needed, and just because they dove into the shallow end, I'm going to take into consideration C-spine precautions, put them in a C-collar.
Okay, so lifeguard, you get right on scene, lifeguards are extricating the victim from the pool.
Okay.
He does not have a C-collar yet applied,
Okay.
and he is on the backboard.
I'm going to have one of my partners hold manual C-spine of my patient.
Okay.
My general impression of my patient is poor due to them being unresponsive and the MOI. Any apparent life threat?
No.
That I see? No? Okay. Level of consciousness for my patient right now?
Unresponsive.
Unresponsive. All right. My chief complaint right now is unresponsive from diving into the shallow end of the pool. I'm going to check my airway. Is it patent?
It is clear.
Clear. I'm going to check my breathing. Are they breathing right now?
They're breathing like 8 times a minute.
8 times a minute. I'm going to put in oral adjuncts, 15 liters per minute of oxygen, and assist their ventilations, 12 to 20 per minute. What about my circulation? How's my pulse, rate, rhythm, quality?
You'll notice that his head and mid-old chest is pink, warm, and dry, and then the rest of it, down to his abdomen through his legs and arms, is pale, cool, diaphoretic.
Okay. Noted. So those are my skin signs right there. Taking those into consideration. What's his GCS? Right
3.
now? 3. Due to his GCS, rapid transport to the hospital is my decision right now. So I'm going to get him loaded into the ambulance and ready to go. I'm also going to have my partners start getting a set of vitals, 2 large bore bilateral IVs on either side.
Okay.
Checking his skull. Do I see anything on the posterior, anterior, top?
No, he has like some road rash on his forehead from hitting the bottom of the pool, but everything else is clear.
What about haloing around the ears, decap, BTLS?
Clear.
Clear. My eyes, pupils.
One is... They're clear.
Clear? Okay.
Yeah, pearl.
Cheekbones, nose, any secretions in my nose?
No.
Is my airway still patent?
Yeah, your adjuncts are doing good.
Okay. And my ventilations are still going in well? Okay. What about my neck? C-spine?
You notice a step off.
Step off?
On
Okay.
his neck.
C-collar is going to be put in place. What about for his neck? JUD, tracheal deviation, pulses?
No, sir.
Okay. Moving down to his chest, and that C-collar has been put on as well.
Okay.
Then all backboard precautions will also be done in time. Any chest issues, decap, BTLS, flail segments?
No, those are clear.
Am I getting good equal bilateral rise and fall of the chest with my
Yes.
ventilations? Okay. Going down, checking his abdomen, anything?
Nope, it's unremarkable.
Okay. What about his pelvis?
Stable.
Stable. His legs, anything for his legs?
Clear.
Clear. They were pale, cool, and diaphoretic. Do I have CMS?
Yeah, pulse rate is bradycardic.
Bradycardic right now?
Yeah.
Okay. For his arms, decap, BTLS, CMS, pulses.
Same, bradycardic.
Bradycardic. Noted. And then I'm also going to flip my patient before I put him all the way onto the backboard just to check his back. Anything?
No, back's clear.
Okay.
No step-offs noted.
All right. Going to get this patient loaded up. What are my vital signs for this
Your
patient?
blood pressure is 50/20.
Noted. What about my pulse?
Oh, sorry. Heart rate is 55.
55? Okay. What about respirations right now with assisted? Is he still taking those well?
Yep, you're assisted.
Okay. SVO2?
98%.
98% with the 15
yeah,
liters
15
going.
liters.
Okay. Noted. I'm also going to just have like 4 lead going as well.
All right, sinus Brady.
Sinus Brady? Perfect. I'm going to have 20 mils per kilogram of fluid running on this patient as well. Due to the lower blood pressure, I'm also going to do a Levophed drip as well. It's going to be 8 micrograms per minute, 30 drops, and I'm going to do 4 milligrams and 250 milliliters of D5W, which comes out to 1,600 micrograms. Do I see any improvement with those to my blood pressure?
Yeah, blood pressure is coming back up.
What about my heart rate?
It's 60 now, yeah.
60, okay. I'm going to always reassess my my vitals, my interventions, and my patient's condition as well en route to the hospital with my rapid transport.
Okay, what do you think's going on with this patient?
I believe that my patient hit their head, is having some sort of neurogenic shock at this time.
I would agree with you. Anything else you'd like to add?
No.
Good job.